Okay, so state board is going to be broken down into section by section. For state board, your practical, the first section is your work area preparation and setup of supplies. They are going to give you exactly what the proctors are going to say to you. So you have all the information. We do not have a rubric of how many points they take off for certain things. So keep that in mind. I can't answer questions of, if I forget to do this, will I lose points? I don't know. We try our best based off of the information that they give us in here. And then me and Miss Christina, this was like our brainchild of step by step how we've been doing and teaching it. I will say this, I have been teaching it this way with these exact guidelines. They've been updated a few times to make things easier to read, but like they have all been passing. So everybody that we've been doing this through has been going through and doing really well on state board, which should ease your minds a little bit, because I know this starts to get to be like the anxiety part when we start talking about state board. It's a little overwhelming, but we're going to go through section by section and I'll talk through it, and I'm going to use the guidelines as we go today too. So the proctor is going to read to you. You will prepare your work area for your client. You will set up the universal supplies you will use throughout the examination. You will also set up the supplies for the basic facial section of the examination. You will be expected to follow all client protection, safety, and infection control procedures. You will have 10 minutes to complete this section. You will be informed when you have 5 minutes remaining. Do not demonstrate any procedures until the verbal instructions are given and you are instructed to begin. Step back to indicate you have finished. In real life, they're going to read these instructions to you twice, that exact same way, and then they're going to say, you may begin. So at that point, your kit in real life is going to be on the floor, and you will be standing the whole time, and you'll be bending down getting stuff out of your kit. I don't care if you guys practice sitting down. I'm going to sit down today. Like I said, I'm old and my back hurts. So I'm going to sit down today, but your kit is generally going to be on the floor. So an important thing about your kit has to always be closed. Every time you go in and out of your kit, you have to reclose your kit. So we're going to open our kit, and we are going to pull out, first bullet point there, our work area bag and our 3 paper bags. We're going to pull these out onto our station, and we are going to close our kit back up. State board is all about sanitation, infection control. The majority of your points are going to come from sanitation and infection control. So there are some things that you have to do in kind of specific ways. So after we have our bags out, we are going to use our trash to be disinfected, soiled linens, and go ahead and set them up. You're going to do this before you clean, because you don't want to not have a place to throw away your trash and everything. The bags have a label that goes to the proctor, but there's also a label on the inside of the bags so that you guys can see them. So I like to put the trash like closest to me, so that it is like easily accessible. You're gonna have more trash than you are like soiled linens or anything like that. I'm gonna put it a little bit further just because I feel like you guys will be able to see better. To be disinfected. And soiled linens. Is this like completely blocking? Maybe I should put them on this side.
Kinda, yeah.
Let's do this. So I'll put the labels so that you guys can see them. Soiled linens to be disinfected. That way the camera can see them better. All right, cool. All right, so we have our 3 bags out. Now we have our work area bag. You don't want to take everything out of this bag. Start with the basics. So the first thing you're going to do is take out your hand sanitizer, sanitize your hands. You can put that down. Once you take something out of the bag, you're not going to put it back in the bag. So after we sanitize our hands, we're going to take out a pair of gloves because we're going to disinfect our area. And anytime you're using hospital grade disinfectant, EPA grade disinfectant, you have to have gloves on. So like think about like your cavi wipes and all that. We really should have gloves on when we use them. So now you're going to take out your disinfectant wipe. We have a couple different brands. Some will say like cavi wipes, Sani wipes, all the same thing. You're going to take it, you're going to open it, and you're going to lift up everything on your station, and you are going to sanitize your whole station. You could even wipe underneath your bags, wipe everything at your station. So your sanitizing wipe is going to go in your trash. Your gloves going to go in your trash. Anytime we throw things away, you're going to sanitize your hands. If you put anything in any of these 3 brown bags, you're going to sanitize your hands. So now we're going to sanitize our hands. And our area is clean now. So now we can actually get out our work area. We're going to take 1 paper towel and unfold it. When I put this out, this is going to stay here for the rest of the exam through all the sections, not just the facial. This is going to be our universal supplies. The paper towels are like the trifold kind. I always like turn it in a way that it's not like coming up on itself. So kind of turn it however works for you. Your hand sanitizer is going to go on there. There is water, toner, and alcohol bottles. They're going to go on here. In real life, I would stand them up on these beds. You guys can lay them down. In real life, you guys are going to have tables. You're going to have more sanitizing wipes that you're going to need later. You're going to have extra gloves. You're going to need those later. And then the rest of your paper towels, you're going to put those out as well because you're going to need those throughout your exam. Your work area bag, this one can go in your trash. I recommend trying to like consolidate your trash instead of just like balling everything up, because your trash bags are only so big and you have to get through several services and you don't want like things like seeping out of your bag. So try to keep your trash small. So trash, because I threw it away. Now I have to sanitize my hands again. So now we have our basic setup going, the 3 bags and our universal supplies. Again, this is going to stay out the whole exam. I sanitize my hands so I can go back into the kit. The kit is considered like clean storage. What if I do this? Sanitize. Yep, exactly. So sanitize your hands again. So anytime, if you touch your bangs, if you touch your glasses, anything you're doing, make sure you sanitize your hands. So I'm going to go back in my kit. Now I'm going to get the rest of the supplies for the first section of the exam, which is going to be our basic facial bag, our new client setup bag, and our client. So I recommend trying to grab everything all at one time instead of going in and out of your kit. So you can put everything up on your table. Remember, your table is clean now. And we are going to reclose our kit. We're not going to start the facial at this point. Remember, this is just a 10-minute section for setup. So what we're going to do here, what I would recommend, taking your basic facial bag. You have mini bags in here. So take your cleansing, your exfoliating, your massage, and your facial mask. Put them in order because that's the order that you're going to be using them in. So put your bags in order. And then your new client setup, you're gonna use that. And you can put your Lisa anywhere. In real life, she'll have shoulders, so you can kind of stand her up like this so she takes up less room, but she's gonna be over here. Your basic facial bag can go ahead in the trash as well. I threw it away, so I'm gonna sanitize my hands. And I'm gonna step back when complete.